Hello friends, welcome to a new live broadcast. I'm Marcos Sacristan, your favorite physical therapist. And in today's broadcast we're going to talk about, and I'm going to show you a routine of about 15 to 20 minutes designed to combat knee wear and tear. A simple routine that everyone can do. In fact, these are very simple exercises that are suitable for any age and that progressively increase in difficulty. We all know that wear and tear, or what we can also call knee osteoarthritis, is an aging process, a natural degradation of the articular surfaces and components of the knee that occurs as we get older. Just like gray hair appears or even wrinkles on the forehead, we have to understand that it's joint aging related to age. And just like some people get gray hair earlier or look older sooner, the same thing happens with osteoarthritis. Knee osteoarthritis or knee wear and tear, there are people who will develop that degeneration earlier, and it mainly depends on hereditary factors, genetic factors linked to your family. I'm not going to talk too much. Let's quickly get to the exercises. I just want to mention who this routine is for. For anyone who has any sign of knee osteoarthritis, joint wear and tear, especially in the cartilage, which is the structure most affected in knee osteoarthritis. Also for those of you who have patellar chondromalacia, which is simply the wear of the back part of the kneecap, okay? The kneecap is that little bone we have in front of the knee, and the wear on the back is called chondromalacia. All of you who have a knee sprain, this routine will also help you strengthen all the muscles around the knee and allow for better stability and slow down the progression of that degeneration. Meniscus injuries as well are joint injuries that are often linked to the onset of that osteoarthritis. In knee surgeries, such as a knee replacement or a knee prosthesis, these exercises will help you both before and after surgery to start regaining that muscle strength that is suddenly lost after the operation. For all of you who have non-specific knee pain and don't know its origin, strengthening the quadriceps will always help improve those knee symptoms. And finally, as a preventive measure, if you are young and have any signs of osteoarthritis in your knees, starting to exercise will help you preserve them for longer and prevent osteoarthritis from progressing more quickly. One important detail, knee osteoarthritis, or wear and tear in the knee, is a chronic disease, meaning it cannot be reversed. We can't go back to a previous state of our knee, just like we can't make ourselves younger and take years off. Okay? Something very important. With this routine, we can keep it under control and relieve the symptoms. So now let's move over here to the side, and let's start with the exercises. To carry out the routine, you will need several objects, but nothing out of the ordinary. You can easily find all of them in your home without any problem. I have here a medium-sized towel which we'll use for the first exercises, and I also have cushions of different sizes. A small cushion, a slightly larger cushion that is part of the backrest of my armchair, which we'll see next, and finally a slightly bulkier elastic band, but it can also be replaced by a belt. We start with the simplest exercise, an isometric contraction of the quadriceps. I'm going to do all the exercises with one leg, just one, so it doesn't take too long. I'm going small. If you have osteoarthritis in both knees, well, do it with one, pause the video, and repeat with the other, the opposite leg. I like to do all the sets with one leg before switching to the other to achieve greater muscle fatigue. First exercise, we take the towel, fold it several times, and then roll it up until we make a roll like this. We're going to place it behind the knee. To do the exercise, you can stay seated like me, but if you're more comfortable, you can lie on your back. I'm going to stay seated because my voice is easier to understand this way. What we're going to do here, placing the leg nice and straight with the big toe pointing up toward the ceiling, is press that towel down, press it firmly, and at the same time pull your toes toward you. This ensures an isometric contraction of the quadriceps, a lifting of the kneecap, and we'll notice that the front muscle of the leg becomes harder and more tense. An important point, the heel does not lift off the floor, it always stays down, and we're going to make a movement in a small range, meaning you'll barely see it move. It's basically an isometric contraction with almost no movement. We hold for 1, 2, 3, 4, and 5, and then relax. Relax your foot, relax your knee, and the quadriceps becomes soft. Let's go again. Press down firmly for 1, 2, 3, 4, and 5. Relax. We've done 2, let's do 10 repetitions together. Press down firmly, toes toward me, 1, 2, 3. 3, 4, and 5, with that heel always in contact with the floor without lifting it at all. Isometric contraction, press down firmly, 1, 2, 3, 4, and 5. We've done 4 repetitions, relax, let's go again, press down, pull your toes toward me and hold for 5 seconds. This contraction allows us to activate the tibialis anterior, the muscle that pulls the foot upward and enables a more effective contraction of the quadriceps. Since there are certain muscles that work in synergy within a muscle chain, when they contract together, there is greater muscle activation. That's why we lift your toes up. This is the 6th, 2, 3, 4, and 5, relax. Let's go with 7. 7th, press down firmly, 2, 3, 4, 5, relax, 3, let's go again. 1, 2, 3, 4, 5, relax. Last 2 repetitions, press down firmly, 1, 2, 3, 4, 5, relax. Last repetition, press down 1, 2 foot towards me, 3, 4, and 5, perfect. If you want to make this exercise a little more challenging, we can use the cushion, fold it a bit more to add more height under the knee and make the range of motion a little wider. However, the heel must always stay in contact with the floor, no exceptions. Perfect. I'll leave the cushion here and the towel here as well. Let's move on to the next exercise. Let's lie down, this time flat on your back, facing the ceiling to do the exercise correctly. From here, what we're going to do is bend the leg we're not going to work on, pull your toes toward you and lift the straight leg. Not too much. About 20 or 30 centimeters off the ground. 1, 2, 3, 4, and 5. Relax and rest your leg. This time your big toe doesn't have to be pointing straight up, but should be slightly turned outward. 45 degrees outward, so we can focus the work on the vastus medialis, which is the most important part of the quadriceps. So instead of keeping it pointing up, we're going to rotate it a little outward to focus more of the work on the vastus medialis. 1, 2, 3, 4, and 5, relax. The transition from the first to the second exercise can be quite demanding, especially for those of you who have had knee replacement surgery, so in that case I recommend using that belt and placing it under your toes. I'm using a resistance band, but you can use a belt, a blanket, any kind of object. Tilt that leg as we've seen, and as you lift the leg, help it a little with your hands so your muscles can lift the leg without getting overly fatigued. The hands should simply be a help, an external support point, and they shouldn't do the work by themselves, since it wouldn't make any sense to do the exercise this way. The resistance band or the belt is just a little help if you're not able to lift your leg. Let's go with the 4th repetition. 1, 2, 3, 4, and 5. Something that happens a lot with knee prostheses is that at first we're not able to lift the leg because of the quadriceps inhibition that happens after surgery. 3, 4, and 5. We've done 5 repetitions. Let's do 5 more. 1, 2, 3, 4, and 5. Relax. If we stretch the leg, if we also stretch the opposite one, we can make the exercise slightly more difficult since we lose that lever arm by having the foot supported. 1, 2, 3, 4, and 5. Perfect. We have 3 left. And we can also lean forward to increase the difficulty of the exercise a bit more, since by introducing a hip flexion, the quadriceps muscle needs more strength to lift the leg. Here we can also use the support of the opposite leg. We can place the supporting foot close to the body or farther away to add even more difficulty. 5. We have 1 repetition left. We've done 10. I've shown you a lot of variations, so you can use the one that best fits your abilities. Oof, it looks like an easy exercise, but I assure you my quadriceps are pretty fatigued. Very good, let's continue. This time we take our small cushion again and place it behind the knee. I think I'm going to take a slightly bigger cushion to demonstrate it better. Here I am. In this exercise, the bigger the cushion, the more difficult the exercise will be. I'm going to show you 2 examples, one with a simple small cushion and one with a larger cushion from the backrest of my sofa. From here, you can do the exercise however you want, either lying on your back or sitting up like I am. What we're going to do now is a combination of the two exercises we've seen. I'm going to do it right on the edge so you can see it. And it consists of pressing down on that cushion as we've seen before and then lifting the leg. This time we lift it all the way up. We're not going to leave that heel resting, and we're going to bring your toes toward you. 1, 2, 3, 4, and 5. Don't forget that slight outward movement of the foot. Make sure your toes aren't just pointing straight up. Turn your foot out a little, about 30 to 45 degrees of rotation. External, relax, press again and lower it. 1, 2, 3, 4, and 5. Relax, relax. I press again, lower it, keep that knee strong. 1, 2, 1, a rob stem from below. I have 2 left. Support. 1, 2, 3, 4, 5. Lower it. Last repetition so you can see it clearly. Lower it, straighten. 2, 3, 4, and 5. I said last one, but there are 5 more. What I want is to show you what the exercise looks like with a thicker cushion. That makes things much more complicated. I'm going to lie down to get comfortable. And as you can see, we start from a greater knee flexion, therefore the range of motion is greater and the force you need to develop in the movement is also greater. Let's do the following. Press this cushion down and then lift your leg. Keep your toes slightly turned out. 2, 3, 4, and 5. Lower it. And as soon as my heel touches, I lift again. 1, 2, 3, 4, and 5. Touch down, lift again. Toe pointing toward me. And 2, 3, 4, and 5. We have 2 left, and don't forget that slight downward pressure on the cushion to allow for a more effective contraction. Always pressing down a little with that leg to achieve an intense contraction of the vastus medialis, the inner quadriceps muscle. I think we have 2 left. 1, 2, 3, 4, and 5. Okay. Touch, lift. 1, 2, 3, 4, and 5. Perfect. Remember, we can make the exercises more challenging by adding these weights. Ankle weights. I recommend using between 1 and 2 kilos so you don't make the exercise too difficult. This obviously increases the resistance from gravity and makes the exercise much more challenging. Recommended only for those of you who have a more advanced level and greater quadriceps strength. As you can see, there are multiple ways to combine these things, these modifications, these alternatives, so that the exercise adapts as much as possible to your abilities, which is ultimately the goal of all this. Next, we'll move to the couch. I'm going to clear all this out a little bit. I'm switching the camera. Let's sit on the edge of the couch to do some really good quadriceps extensions for your knee. The goal is to sit back, way back, so I'm going to move the camera a little closer so you can see me better. I think we'll be good there. Perfect. Sit back, way back, so that in that bent position, the back of your calf is almost touching the couch as far back as possible. From here, it's basically the same movement. What we're going to do is extend that leg as much as possible and then pull your toes toward you. 1, 2, 3, 4, and 5. Relax and return to the starting position. As always, you know that foot has to be slightly turned outward, not just facing up, to focus more of the work on the vastus medialis. And a little trick that also works well for me is to lift your hips a bit so your feet don't touch the floor. This will work the muscles better. I'm very tall, I have very long legs, and in my case it's quite difficult, but if you use a couple of cushions, the position will be more comfortable and you'll probably be able to do the exercise much better. Always try to make sure your foot barely touches the floor or is even lifted. 1, 2, 3, 4, and 5. Relax. Put your foot down and let's continue. 1, 2, 3, 4, and 5. We've done 3. 1, 2, 3, 4, 3, 4, and 5. 4. 1, 2, 3, 4, and 5. 5 repetitions. We have 5 more left. 1, 2, 3. 4 and 5. 6. 1, 2, 3, 4 and 5. 7. We only have 3 left to finish, and I assure you my knee is already very tired. 4 and 5. And I'm really feeling it in my thigh. 2 repetitions. 1, 2, 3, 4 and 5. Relax. Last repetition. 1, 2, 3, 4 and 5. Perfect. Excellent work on the quadriceps. I'm just going to grab a little bit of equipment from over here. A chair to show you the next movement. Give me a second. 1 second. Let's grab a chair, put it near the couch and remove the rug. By the way, a quick note. In this exercise that you do sitting on the edge of the couch, you can also use an ankle weight to make the exercise exponentially more challenging. Although, in my opinion, it's already quite a challenging exercise. I'm going to move the camera back a bit more so my head doesn't get cut off, and we're going to tackle the squat movement. How's it going? Am I getting cut off? How about there? Much better. Squat exercise. I recommend placing a chair from your living room in front of you close to the arm of your sofa since we're going to do a half squat. We're not going to go too low, we're just going to put a little bit of pressure on those knees without forcing too much. Place your feet about shoulder width apart with your feet slightly turned out, just like we did in the previous exercises. From here, what we need to do is bend at the hips right here, exactly at this level. How? As if we wanted to sit on the arm of the sofa while holding onto our chair. We rest our buttocks, sit down calmly, and rise with a very controlled, slow movement and good form. We go down, rest, and return again to the starting position. The only precaution with the knees is that they shouldn't collapse inward during the exercise. We always have to maintain a good separation between them. Try to keep those knees always over the pinky toe, the little toe of your foot. That would be ideal. We've done 2 repetitions, let's do 8 more. I sit down very slowly and get up with a controlled, slow, progressive movement. I get up 4, 1, 2, 3, 4, 4. Sit back, touch down, lift up, 5, 4. We continue. I sit back very slowly, touch down, lift up, 6. We have 4 left. Seven. I sit back. I lift. 8. 9. Last repetition. I sit down. I lift. 10. Let's imagine that this exercise is very hard for you, that you can't manage to reach 10 repetitions. It's okay. We can place a couple of cushions which will reduce the range of motion and make the exercise much easier. Now, instead of going all the way down to the sofa, I'm going to stop much earlier and the effort will be much less. A very, very effective variation that can really help you adapt the difficulty of the exercise to your abilities. The next one would be the squat. Classic squat where we don't use the sofa for support but instead try to go as low as possible. To do this, always with the help of a chair, keeping those 2 important points. Feet slightly apart, shoulder width with a slight external rotation, and knees that don't cave inward. What we need to do is bend properly at the hips. I use the chair for support, bend well at the hips, and go a little lower than the armrest of the sofa. Then continue back to the starting position. With a full squat, going down a lot or a little isn't as important as adapting the exercise to your abilities. If you just go down halfway and then come back up, that's perfect. Always do it based on your effort level and your abilities. Let's go with the 4th one. If you go down a little more, perfect. The important thing is to feel some effort, to feel a muscle contraction, a movement, and to feel that we're pushing our body to the limit. Let's go with the 4th one. 5, 6, 7, 8, 9, last repetition, and 10. Perfect. Again, here we can adjust the difficulty by going deeper or less deep and by spreading the legs more or less. The wider your legs are, the shorter the range of motion will be and the easier the exercise will become. The only condition is that your knees don't collapse inward to avoid causing damage to your menisci. There's one last exercise left, which I think we're going to skip. The routine has been pretty complete, short, which is important. Something to motivate you to take your knee strength to the next level and improve the strength of your quadriceps. We're going to show it on screen and I'll give you some tips on how you should pace this routine to get the most out of the exercises and how you should adapt it to your particular conditions. Here I am with you again. Let's go. Let's see. Treatment. I'd also like to explain this a little to address it a bit. The treatment for knee osteoarthritis, knee wear and tear, has different stages, okay? The important thing is to always start with exercise to improve the quality of the muscles around the knee, prevent the progression of osteoarthritis, and obviously keep your knees healthy for as long as possible. Exercise is always the first option. Whatever the rest of the treatment is, exercise has to be the priority. I hope you never forget that. The changes, man. Changes in lifestyle habits are also very important, especially when it comes to weight. Having a healthy weight within normal limits and not being obese is an important factor to prevent the progression of that osteoarthritis and obviously the progression of the symptoms. It's not just about weight. Sleep quality matters too, since the body's healing processes are triggered during sleep. Waste substances are eliminated, inflammatory substances are removed, and sleeping better will lead to a substantial improvement in symptoms, especially if you are going through an acute flare-up of knee pain. Finally, there are other medical alternatives, usually applied by doctors, which are hyaluronic acid injections. What they do is inject a liquid into the knee to improve the sliding between the surfaces that has been lost over the years. That cartilage that has been damaged, that fluid that allows proper sliding inside the joint, loses its quality over the years, and hyaluronic acid is usually lost as well. Not to replace it, but to provide viscosity for a time. This type of injection, again, is not permanent. They usually last around 3 to 6 months and can be a good solution if the patient does not want to have knee surgery or wants to buy some time before having surgery. PRP injections or platelet-rich plasma involve taking a portion of your blood, isolating the plasma, and then reintroducing it into your knee. There are certain studies that seem to indicate that this type of substance improves tissue healing and may help slow the progression of osteoarthritis. These are usually private treatments that you have to pay for out of your own pocket. Personally, I believe that the impact of PRP on the progression of osteoarthritis is small compared to exercise. Exercise will always be the first-line treatment, and PRP would be more of an adjunct therapy. These are therapies like hyaluronic acid that can help slow down the progression of osteoarthritis a bit or delay the need for surgery, since when osteoarthritis progresses a lot. There are certain irreversible situations here where there is, look, as you can see here, a complete loss of cartilage, the formation of osteophytes, which are bone abnormalities around the joint. There comes a point when osteoarthritis is so advanced and there is so much pain and loss of function, lack of knee movement, that surgery becomes necessary. Okay, I know I always advocate for not operating, but in certain cases when osteoarthritis is very severe, surgery is a very reliable option. Because on one hand, if we prolong it, if we delay it too much, we might get a worse outcome, and when we do have surgery, in 99.9% of cases, the result is an absolute success. For example, in Spain, 150,000 knee replacements are performed every year, and it's one of the most advanced surgeries today, both nationally and internationally, because these surgeries are done very frequently and they fight against aging. There's a lot of research. In the best hospitals and with the best surgeons, what they do is a custom-made prosthesis. Only the most damaged part of the bone is cut, just a little bit, just a little, to cut as little as possible, and then a prosthesis is inserted, which in the best cases is custom made in 3 dimensions, custom made and perfectly crafted for you so that the congruence and the joint mechanism of the knee are perfect. There have been many advances in knee prostheses, and whenever that osteoarthritis causes a major impediment, a big problem in daily life, surgery is necessary. I'm very much, how should I put it, someone who supports knee prostheses and knee surgery in very extreme situations. However, if you are going to have knee replacement surgery, the first thing you need to do is exercise to strengthen your muscles and then make lifestyle changes if you are very overweight, since that could impact the health of the prosthesis and obviously its longevity. So these 2 points here are really the foundation, okay? It's not so much about the surgery. Surgery is fine, of course, but first we have to work on this. If you have surgery and you are an obese, sedentary person with no strength, the success of that operation will most likely be very poor. Also, the more you strengthen those knees before surgery, the better the outcome will be afterwards. I have an image here. This is a knee prosthesis. As you can see, it has two components. One that is placed on the femur, another on the tibia, and this, which is a plate, a spacer as it's called, that simply replaces the menisci and serves to maintain a certain space between the tibia and femur. This part here, sometimes they put it in, sometimes they don't. It's the patellar component, and what they do is shave a little bit off the back of the patella to put it in and thus eliminate that osteoarthritis behind the kneecap, especially in cases of patellar chondromalacia. Okay? What else can I tell you? Knee prostheses, and sometimes certain surgeons don't want to implant them just because the patient is young, but honestly, I'm quite against this, since a prosthesis can have an average lifespan of between 15 and 20 years. And it's not unreasonable to do 2 or 3 prosthesis replacements in a patient's lifetime. For example, if you're 65 years old and you have surgery, 15 years later at 80, you could have a knee replacement. It will be practically the same surgery, except that the stem, which is the part that goes inside the bone, here you can see it more easily, is longer and goes further. Anyway, in 15 years, technology will surely have advanced even more, and the prostheses will be much better than the ones we have now. So if your situation is very severe, I always recommend a knee replacement, because the results are exceptional. And the testimony from people, I've treated a lot of patients with knee replacements, is always the same. I wish I had had the surgery sooner. Well, getting back to the routine, dosage. Let's choose 4 or 5. No, let's choose 4 exercises, 3 or 4. 4 or 5 is too many. To do with both legs, because remember that osteoarthritis or wear and tear is usually bilateral. We're going to do 3 or 4 exercises, completing 4 sets of 10 to 12 repetitions. I've only shown you 1 set of 10 repetitions. What you can do is simply pause the video and repeat the movement again. Repeat that routine 3 times a week to achieve consistent results after 3 or 4 weeks. And obviously take a rest day, since rest and inactivity are also very important when we exercise. Finally, adding a bit of cardiovascular work, a bit of movement to that knee by walking for an hour 3 times a week is an ideal and complementary therapy to the exercises. Finally, as you already know, if there is obesity, prioritizing weight loss is extremely important. And also exercising in a pool. If these exercises are too difficult, what can we do? What alternatives do we have left? Go to a pool and do exercises. I recorded this video last year and it's very, very good. You will find the exercises you can do in the pool. And not only that, you will be able to download a PDF with all the exercises, so you don't have to use your phone in the pool and risk dropping it in the water. So you can have a printout and follow the exercises. In 3 weeks, I will record a lot of videos in the pool, which will be very useful. It's something you asked me for a lot, and well, I haven't been able to record until now, but after my vacation, I will be able to give you a lot more content. A very useful option for those of you who are overweight, have a lot of pain, or can't do these simple exercises. Lastly, how can I know if an exercise is causing me discomfort? How can I tell if that discomfort is serious or not? How can I know if that exercise is good even if it causes me pain? I like to use this pain scale, where pain is rated from 0 to 10. 0 means no pain and 10 is the worst pain imaginable. It's a very personal scale for each of you. Each of us has different experiences with pain. And well, the important thing is that when you do an exercise, if it causes you discomfort, don't hold back. Keep doing it as long as the pain is between 0 and 4. Those are completely acceptable pain levels. If the pain increases, we're at 5, 6 or 7. It's an exercise that's too intense. Take a break and it will probably do you more harm than good. Some discomfort is tolerable, but pain is not. So in these cases, I recommend either reducing the number of sets, reducing the number of repetitions, or simply eliminating the exercise. You have a few exercises there that you can try. After all, doing too much exercise while you're in pain isn't good either. That's why I always insist on the importance of rest days. Leave a day of rest between sessions. Exercise is a bit like sunbathing. If you do a lot of exercise from the very first day, you don't give your body the necessary rest. Well, what will happen is that your skin will get irritated, your knee will get irritated, and pain symptoms will appear. It's like sunbathing. If you get too much sun from the very first day, you'll get red. And you'll need anti-inflammatory treatment and certain creams. So everything has to be dosed over time and very gradually so that our body generates the necessary compensations and adapts to the stimulus. We'll finish with this great phrase. The only difference between medicine and poison is that the dose. So you can see that the dose is just as important in prescribing exercise as which exercises to do. We've reached the end, my friends. Half an hour of live streaming. I thank you all for being here, and you know that if you want to support my work, you can do so through the first link in the video description or the first link in the pinned comment, through memberships where for a small amount you support me, and that lets me keep making these very educational videos. We'll spend about 10 minutes on questions. So I encourage you to write in the comments whatever you need. I'll check here, and I've already seen a question. This is a good comment from Oren. Excellent exercises, they really help at home. I show them to my parents and they like doing them with you. I'm really glad. In this case, look, if you really like doing the exercises with me, I can suggest the following. You do a whole set, watch the video once, do a whole set of all the exercises, and then play it again. Do this 3 or 4 times to complete a full routine, something that fits your available time so it can be more complete. And if you want, you can play it, for example, twice for one leg and twice for the other leg. The result is really the same. Let's look at this question that I like. Is riding a bicycle good for the knee? Yes, cycling is a great sport that helps you strengthen your knees, as long as this sport is within your abilities and appropriate for your symptoms. That is, let's remember here, if when cycling you have mild pain, from 0 to 4 or no pain, it would be an excellent activity to strengthen your knees. Most importantly, ensure the seat is properly adjusted to prevent knee bending from causing symptoms. And yes, you can do it without any problem. Really, cycling doesn't have any risk. Only one that you might fall on your knee, but that's rare. Clara, don't worry, because at the end of the video it will be uploaded, as always, to my channel so you can access it without any problem. This question is very funny, Danette. If my knee sounds like crunching eggshells, can I still get better? You should know this cracking or crackling sound isn't always linked to something bad. That is, inside the joint there are a series of fluids called synovial fluid, and that fluid has certain bubbles. When you make sudden movements, well, what can happen is that one of those bubbles bursts, a change in pressure. It's like when we open champagne and you hear that pop, clack. That's all there is to it. In cases where there is very severe osteoarthritis, then it could be a symptom of friction in the joint, of a movement within the ligaments, or it could even be a meniscus problem. But it's nothing to worry about. Having joint crepitus doesn't have to stop you. Just because you hear that crepitus doesn't mean you're damaging your knee. On the contrary, not moving it out of fear is worse than moving it even if it cracks. Many patients come to this conclusion and believe that because it cracks it's something bad, so they choose to do absolutely nothing. That's called kinesiophobia. What is that? Avoiding movement because of incorrect beliefs. That's completely wrong. You're not going to wear out your knee more by making more joint cracking sounds. It's not going to get worse. There won't be a worsening of those cracking sounds. They're a natural part of your knees, of your joint tissue, and you shouldn't worry about them. It's one of the most common questions about knees. Sometimes it's not so much at the joint level, but rather the patella, okay? It can rub slightly against one of the sides. This is the prosthesis. But the knee is really the same, and that can cause the crepitus sound. But you shouldn't worry. That crepitus is not a sign of anything bad. I know many of you wonder about this, and it shouldn't stop you from exercising. You definitely shouldn't stop exercising just because you hear sounds in your knees. Here we have a comment from Beatrice. That's why it's so important to adapt the routine to your abilities. I'll keep going a bit longer to finish. I can't do squats because I have chondromalacia. Well, actually, squats are a good activity for chondromalacia as long as we don't go down too far. If you work through the first part of the range of motion, like we did for example on the edge of the couch, it's an excellent tool to strengthen your quadriceps. However, if you see that this exercise, as I mentioned before, causes you pain beyond a level 4, set it aside, leave it for now, go down less or do fewer repetitions to cause less discomfort in your knee. That's why this scale might seem silly, but it's extremely important so you can guide yourself during your exercises. If there's slight discomfort, it's okay. We can try to do the exercise and evaluate if that discomfort increases the next day. Let's look at another question here. 1. A question from Belordes. Belordes. Yes, in general PRP, platelet-rich plasma, is a newer option, and hyaluronic acid is something older, something that's been used, Belordes, for quite a few years. I think PRP hasn't even been on the market for 20 years, and it's usually a more private type of practice that normally requires you to pay for it. It depends on where you're from. I think in Spain, hyaluronic acid is covered by the public healthcare system, but plasma is not. But as I've already said, those are adjunct therapies that, as always, need to be supported by a change in lifestyle and exercise, especially to achieve significant relief. Yes, of course, obviously, Patricia, you can do these exercises if you have an anterior cruciate ligament injury, if you have any problem with your ligaments, osteoarthritis. These are just a brief summary of the conditions for which you can do this routine. Strengthening that quadriceps will always be beneficial for your knee and to improve its health. Let's take a look at some more comments over here. Look, this is a very good question, okay? From Juan Acosta, he asks, is it a muscle stimulator? Because you know there are TENS devices, which are electrical devices with patches that are usually applied, either to relieve pain, which is their most well-known use, or also to stimulate strength, or rather muscle development. Well, this works as follows. When you send the command from your brain to your muscle to contract the quadriceps, what happens is that you contract that muscle. The quadriceps contracts about 65 or 70% depending on your athletic history and how many times you've done that exercise. The contraction is more or less effective, okay? Not all the fibers contract at the same time. In fact, the strength of a muscle depends on how synchronized all those muscle contractions are. Well, to give you an example, imagine you contract the muscle and engage your fibers at about 65 to 70%. That TENS, that, how do you call it, EMS, that electrical stimulation is going to help you add about 5 or 10% more effectiveness in the muscle contraction. So yes, the exercise does become more effective when you use them, around 10 or 15% more effective. So yes, it's a good option to improve and speed up the recovery of those knees, especially in the short term, particularly in cases where there is greater muscle atrophy. EMS devices in people who are very strong, since they have good muscle tone and strength, have much less effect than in people who are more sedentary and inactive. And they don't do anything at all. In fact, those EMS devices, those electrostimulators, are used a lot at the beginning of rehab after knee replacement because those muscles are very weakened and have hardly any strength. Let's see. Here, look, we have a question from Iris, very interesting. Well, in general, no one should forbid anything because of a condition, okay? It's not like going upstairs is going to have a huge impact on your knees. There are other things that have a stronger impact, like for example, a sedentary lifestyle and obesity have a bigger impact on the health of your knees. In fact, doing nothing is worse than doing something when it comes to the development of osteoarthritis. This is a very mistaken idea because people think the human body works like a car, right? And the more you use your knees, the more they're going to wear out. But that's not true, and I'm going to show you now with a very nice graph. What about stairs? Well, if you're not used to going upstairs and you have muscle pain or knee pain, then going up them can increase your symptoms. But if you use a small set of stairs, for example, and you train little by little in a progressive way, going upstairs is not a problem at all. In fact, it would have very positive effects on strengthening your knee and its stability. Look, I'm going to show you a chart I was preparing for you, Iris, or for anyone who asks. These are the chances of occurrence of osteoarthritis, okay? Of the knee, of joint wear and tear. And we find 2 points where the possibility is very high. This axis here is the position, the likelihood of developing osteoarthritis, high likelihood, low likelihood. And this is the amount of activity we do on a daily basis. A lot of activity, little activity, okay? The graph is easy to understand. So we find 2 points where osteoarthritis develops more easily. When we are very sedentary, little activity, the likelihood of developing osteoarthritis is high. And when we are very, very active, here we're talking about a professional sports level, okay? People who train every day of the week for 3 hours. People who really put a lot of strain on their knees. So, these 2 cases are more likely to develop osteoarthritis than someone who does moderate intensity exercise 3 to 4 times a week. As you can see, there isn't a direct relationship between the amount of activity and the development of osteoarthritis, especially because when you do nothing, it's actually the opposite. Osteoarthritis begins to develop earlier. And this happens with many conditions in the body. With tendinitis, with any back problem, it's always the same. A sedentary lifestyle is much worse than moderate activity. So your question, going back to your question, well, I think this question isn't really well formulated. It's not that it's discouraged, but rather that you should work on going upstairs in a way that's adapted to your abilities, and there wouldn't be any problem at all. It will always be better than staying on your couch waiting for symptom relief to magically appear. Let's see over here. One last little question and we're done. Rosa, is hyaluronic acid a good option? Of course, it's a very good option, but we have to combine that hyaluronic acid with these different treatments. Which are the main ones? Exercise and changing habits, improving sleep quality and losing weight to see a real impact on the knees. With hyaluronic acid, there can be some improvement in symptoms, but it won't last in the long term. One last question over here, gentlemen. One last question. We've touched on some very interesting topics. Here we have this very interesting comment, which once again touches on the topic of the chart I showed you here. Can I jog on a treadmill? I suppose that's what they mean. On a treadmill? Again, it's been shown that doing absolutely nothing is just as bad as doing too much. In fact, there have been studies that, let me remove the comment for a moment so you can see. They compared the progression of knee osteoarthritis over 20 years in very sedentary people, in people who constantly ran marathons, and in people who did medium distances, okay? What did they find? Well, what I showed you with the mouse, that people who were very sedentary and those who had a very high level of physical activity developed osteoarthritis more easily than those who maintained moderate levels of activity. Jogging intermediate distances, between 10 to 20 kilometers, so as long as you're not a high performance or elite athlete, it's going to be very good for your knee health without any doubt. We always rely on studies and evidence, not just what a colleague or doctor says. I base things on proven research. When I publish the video, I'll include some links in the description for you, for those who are interested in reading that kind of documents. Very well, friends. Thank you all for making it to the end. This has been a good live session with lots of useful information, especially on the questions. I truly appreciate you staying until the end, and I hope that some of you have joined me at home with the exercises. We'll see each other again this Thursday at 3 in the afternoon Spanish time for a new live session. This time focused on disc herniation. Best regards, friends. Thank you very much for making it this far. Goodbye.